Did you know roughly 1 in 8 women in the U.S. will develop invasive breast cancer over the course of her lifetime? But there's new evidence proving to be a game changer for women. The study was revealed at the 2015 San Antonio Breast Cancer Symposium, and it showed a mastectomy with reconstruction is more costly and has more complications than a lumpectomy with whole breast irradiation. And it showed the rate of cancer recurrence and survival is essentially the same under both regimens. Now, this is surprising news for researchers, medical providers, and patients, knowing lumpectomies are just as effective and less invasive than full mastectomies. So joining us this morning to talk all about this is breast surgical oncologist at Touro, Dr. John Colfry. Good morning, and thanks so much for coming in.
Good morning. Thank you for having me.
This really is a game changer. We were chatting a little bit before this segment about a family member of mine who got breast cancer, went in and said, double mastectomy, let's do it, let's get rid of this. And that is something that a lot of women think is the best solution. That's changed, huh?
It's very prevalent. You know, we see lots of patients that come in and the fear associated with breast cancer sort of takes over. And they come into my clinic and they say, I'm scared, I want them both off. And so it's my job to really get them past that fear and to help educate them that not everyone really needs a double mastectomy.
And do you think, we've heard about some high-profile celebrities and things like that, do you think it's more of kind of a cultural thing that's changing, a shift that's made women want to do this? I
think it's definitely a cultural phenomenon, especially with the BRCA genes and all the attention that Angelina Jolie received. I think it really is a cultural phenomenon.
Okay, so let's talk a little bit more about this study and the results that came out. And basically, they're looking at the time after you have the surgery, the recovery, the complications. Tell me a little bit more about this.
Correct. So this study was done by actually a radiation oncologist named Ben Smith at MD Anderson Cancer Center that I was lucky enough to have the opportunity to work with. And so he analyzed a couple of databases, a couple of population databases in the United States, looking at basically how many mastectomies are being done in the country, what's the trend, and then looking at complication rates from this and the cost associated with the complication rates.
And the cost, the complications, much higher.
Right. Complications from a lumpectomy with radiation versus complications from a mastectomy with full reconstruction is almost tenfold. It was $1,300 for a complication from lumpectomy with radiation versus over $10,000 if you have a complication from a mastectomy with reconstruction.
And when you're talking about a mastectomy, the recovery time is much worse as well, is it not?
If you have full reconstruction after mastectomy, the recovery time is intense. You're in the hospital for about 4 to 5 days where they're monitoring your skin flaps very closely. And the pain associated with the surgery, the recovery, is more intense and for a longer period of time, a couple of weeks.
Okay, so I guess what was so surprising about this study, though, was that the effectiveness of both was essentially the same, huh?
Right, and you know, this is something that we have actually known now for 20 to 30 years. There's good data that has shown that there is no difference between a lumpectomy with radiation versus a mastectomy. The 5-year survival rates are no different. The 10-year survival rates are no different. The recurrence rates are no different between the two. It's like comparing apples to apples. So again, it's important for me to make sure we educate people to know this and to know that they're really, that both results are equivalent.
So surprising for the general public, maybe not as much for medical professionals.
Correct.
Correct. Okay, so let's talk a little bit about breast cancer. Who gets breast cancer? You threw out a couple of those genes that we've heard about, but it's not all based on whether or not your mom or your grandma had breast cancer.
It's not, and honestly, you know, inherited breast cancer is only about 10% of all breast cancers.
Which is so surprising. They always ask about family history. You always assume if it runs in your family, you have such a higher risk.
Very surprising. And honestly, about 90% of it is really due to environmental factors that we don't even really understand that much about. It may be due to lifetime estrogen exposure. but we get so much attention with the inherited and the genetic aspects of breast cancer that we sometimes forget, again, the majority of it is environmental factors.
And you said there, are some things we just don't know, and that's cancer in general, but there are some things that we do know.
Correct.
Healthy lifestyle. What are some of the tips that you offer people who are worried about cancer?
Right. One of the biggest things I encourage people when they come to see me in my clinic is exercise, exercise, exercise. It's been shown to decrease your risk of developing breast cancer. It's been shown if you have a breast cancer, your likelihood of developing another one is decreased with exercise. So again, we can't stress that enough. Healthy eating, also very important, good nutrition. Alcohol in moderation, no smoking. And again, exercise, decreased obesity has also been shown to decrease your risk of developing breast cancer.
We hear that all the time, but really you can't say it enough, because for breast cancer and so many other aspects of our health, exercise, eating right, staying active, important stuff.
Very important.
Yeah. Now, for the very small percentage of people who do have the gene, the kind of breast cancer gene, can you talk about what that is and how someone might know if they do have that? Right.
So testing for the gene is important if your family history dictates it. So we test people who have a couple of family members in the family that have had breast cancer, whether or not they were first-degree relatives, meaning your mother, your sister, versus second versus third-degree relatives. That's important for genetic testing. If you've had somebody in the family whose age is 45 or less, that really gets our attention, and we also like to send a genetic test on those people.
Okay.
So let's say the genetic test should come back positive. Then some of these things that we're talking about, bilateral mastectomies, in that sense, it is appropriate. It does decrease your risk, because these, again, if you're BRCA1 or BRCA2 gene positive, your risk of developing breast cancer over your lifetime is 45 to 80%. So a double mastectomy for those patients does make sense.
Yeah, might be a better option. Okay, we're out of time, but real quickly before we go, what should people be asking their doctors?
It's important for them to ask their doctors about their family history. We really need to dig deeper into people's family history. We really need to know the family members' ages when they were diagnosed, and most importantly, mammograms. Continue to have your screening mammograms. Continue to push for your screening mammograms starting at age 40.
Okay, really great information. Thank you so much for coming in. We
Thank
sure
you.
Appreciate it.
Appreciate it.
And if you do want more information regarding breast cancer and treatment options, you can visit WGNO.com, click on the 411.